Good afternoon, everyone, and thank you for joining me. My name is Kelsey O'Donnell here inside the digital studio for our brand new segment, Now in ENC, right on WNCT.com. It's a brand new segment, like I mentioned, that we'll be bringing to you live to your screens, your internet, to talk about events happening here in Eastern North Carolina, but not only events, hot topics that are surrounding the community, which we'll get to in just a minute. This afternoon, I am joined by Dr. Nathan Harper, a psychiatrist at Vidant Medical Center and ECU. First of all, Dr. Harper, thank you for joining me this afternoon.
Well, thank you for having me.
So what I do want to talk about, you are a doctor that focuses on mental health. And obviously this has been a really big topic, not only here recently, but for the past year in Eastern North Carolina, across the world with everything going on with COVID-19. What have you experienced as a doctor here in Greenville?
So kind of initially when this was all kind of coming together or happening, we were encouraging patients to stay away from the hospital and to only seek treatment if needed. There was a lot that wasn't known about the pandemic, how contagious it might be, how dangerous it might be. So in abundance of caution, we asked patients not to come in unless they felt like they absolutely needed it.
Right.
And then also outpatient providers didn't know exactly what to do. And this is when nobody usually was using Zoom or WebEx. And so those patients weren't being seen either for physical problems and for mental health. So we were telling people don't come to the hospital for their own safety. And also outpatient providers were trying to figure out how they could see these patients safely. And so there was a lot of confusion and worry at the beginning and a lot of limited access to care.
Mm-hmm. So why do you feel as though it's important to, take care of your mental health? Obviously this, like we did mention, it's a very critical time within the past year. Everyone was learning through new ways of how to deal and cope with everything. But specifically from your end, why do you feel as though it's important, to take care of that mental health?
Yeah, so it's been known for a long time that there's a mind-body connection. So there's been different studies and things that I've seen that people who have deteriorating mental health, their physical problems are worse. And then for patients whose physical problems get worse, their mental health is affected. So it's kind of a loop. And so to address one without the other will lead to a problem in the other. So if you don't take both into an account, you'll suffer in both areas.
Mm-hmm. And how do you feel as though this ongoing pandemic has affected that over the past year, if not more?
Yeah, so the CDC looked at people experiencing this with a survey they did not that long ago. And so what it found out comparing pre and post COVID was that, about 1 in 10 people were experiencing struggling with mental health and substance abuse issues before. And then during it, that went to about 1 in 4. And so people were experiencing new mental health and new substance use problems. And then people who already had those issues reported a worsening in their mental health and also increased use of those substances.
And you see it firsthand. We've seen it here. We were stuck at home for the most part. How did you tell people, and still now, to take care of your mental health? What were those next steps with overcoming everything that we were going through and some people continue to go through?
Sure. So as technology and other things kind of caught up to the situation that we were in, we were able to talk to patients about getting access to care through virtual means, even if that was just through a telephone. So oftentimes we were doing just telephone appointments. And then that progressed into Zoom and then progressed into, precautions like wearing a mask and to having your temperature taken. So we tried to use the information as it came out on how to re-engage with patients to take care of their mental health. And, what other ways could we do to reach out to them when this one-on-one contact and social distancing had become kind of the norm for everybody?
Sure. So I know we're wrapping up the end of May, but May is Mental Health Awareness Month. You guys at Vidant did host a couple of, I believe it was seminars.
Mm-hmm. Yep. So what they did, they hosted Mental Health Matters, which was a WebEx, which is kind of a virtual kind of lecture and discussion series. And that was hosted every Wednesday in May. It was online and free. And people could get on, listen to the talk. They varied from mental health issues like anxiety and depression coping skills, and substance use. And then we gave time at the end for people to ask questions. And so those have all been recorded and should be uploaded today. I think there's 4 of them, and you can find those at vidanthealth.com/behavioral health.
Okay. Were you featured in any of them at all?
Yeah, actually, I did. I did one, the first one about how kind of the coincidence of mental health issues and coronavirus pandemic and how those things intersect.
Okay. So for people at home, sometimes I guess recognizing and realizing that you do have a mental health, you need help. How can they, what are those steps, to reach out and get help?
Sure. So those all vary, but, as we're kind of how things stand today, most people are able to get into where they're virtually or in person to see their care providers, whether that be primary care or psychiatry or, even, some specialty service. And, most mental health treatment is often done in the United States by primary care providers. So mentioning your issues to your primary care providers, discussing with family, things like the mental health matters lectures that we put online. So to get engaged with and participate in things and activities that can improve mental health for people.
Okay. Do you have any examples of them? Any activities that would benefit?
Yeah. So I think one of the things, and again, this is kind of evolving thing, is exercise. Actually, if there's something that I think doctors could prescribe sometimes that would really help, if people can get even as little as 10 minutes of exercise 3 to 4 times a week, that not only helps their physical health, it goes a long way to help their mental health. Being that we're allowed to be outside more, not have to go through to some precautions outside, I would suggest, as the weather gets better, get outside, trying to get some exercise. And that would one of the strategies that we're suggesting for people to do to kind of improve both their mental health and their physical health.
Absolutely. And I totally agree. I can feel it firsthand, just getting outside and get those endorphins going once you get exercising a little bit more. But from a personal standpoint, how has this past year impacted you personally as a doctor, going through the pandemic? Has your mental health faltered at all?
I think it was strange. I saw a lot of people who had a lot of anxiety and worry about having a job, and being sent home on furlough and things like that. And for me, I knew that wasn't going to be an issue, but I felt very kind of empathetic for the people who had to deal with that. From our perspective, our life didn't change that much, but sometimes we did have to work more and have to come in contact with patients who did have COVID, where most of the time it was something people avoided. But, I had a hospital system full of friends, other coworkers going through the same thing. And I think probably what got most of us through was the kind of camaraderie of having those people there with you every day, going through the same thing, and kind of a shoulder you had there to lean on.
Absolutely. And then talking about resource to wrap things up a little bit, I know you did mention a little bit before, but what are the resources and how can people reach out to get help? Do they reach out to you guys at Vidant Medical Center? Are there other resources?
Yeah, so there's different things. Certainly Vidant Medical Center, the last place we usually want to engage people, if we can help it, is the emergency room. But it's there, it's 24/7, it's there for emergencies, for people who find themselves kind of in dire straits, difficult consequences, and situations where they feel like they really need help and need it quickly. They also have their primary care providers and other providers, where that might be a therapist. There is also our kind of community spiritual leaders that have taken a big role to help comfort and to reach out to people suffering during this period. There's actually developed quite a few online resources, some websites and even apps that people use to receive psychotherapy or personal therapy.
That is, very good to know with all of, I didn't mean to cut you off there, but that absolutely, I wouldn't have thought of apps at all in my first line of contact at all.
Yeah, that's kind of a new technology, and so the that having maybe something there in your pocket, a phone or something that allows you to do meditation or talk a couple times a week with a therapist. So it's a new field, but I've seen a lot of people taking advantage of it, especially during the pandemic.
Now, does Vidant Medical Center here in Greenville have a specific app that's ready for download?
There's not one that I know exactly off the top of my head. There
Okay.
may be one, but I'm not aware of it.
Okay. Well, it's good to know. And I think one of the biggest things is, I'm sure can reiterate, is just breaking the silence,
Yep.
talking and making sure people are okay and reaching out in that sense. So, Dr. Harper, I appreciate you joining me this afternoon. Did you have any other closing comments or remarks about mental health?
Yeah, I think, one of the things that gets brought up is that, mental health can be stigmatized at times. And so um, we often don't stigmatize people with high blood pressure or diabetes or, other, people who catch pneumonia or
Mhm.
coronavirus. And so most physicians would say, we view mental illness very similar. These are illnesses that people don't ask for, they don't, want, and they can be devastating. So, I would say that if we looked at mental health in this kind of similar fashion we do as other physical, kind of chronic illnesses or illnesses, that would go a long way to kind of destigmatize, some of the issues around mental health.
Absolutely. Well, it's all great talking points. Obviously, we will have more of these coming up on a weekly basis. Hopefully, we'll be able to catch up with you guys again at Vidant Medical Center in the near
Mhm.
future. Talk about just topics that are trending in our community. Mental health absolutely is one of the biggest ones we've focused on over the past year and continue to focus on with COVID-19. But be on the lookout for other events coming up. Vidant, are you guys hosting any other sort of mental health seminars coming up?
So right now, I don't know if there's kind of any in the plans at the moment, but kind of based on the success we've had with these, I would not be surprised if this is something we try to kind of
Mhm.
engage with the community in going forward.
All right, awesome. Well, Dr. Harper, thank you so much for joining us here on Now in ENC. And to our viewers, thank you for tuning in. You've made it this far, and we've got some more awesome content online at WNCT.com as well. Have a great evening.